Ms. Smith, can I come in?
Yep.
Hi there.
Hi.
My name is Sarah, and I'm a nurse practitioner student. What brings you in today?
Just here for a physical exam.
Okay. Any other complaints?
No.
Okay. Are you having any pain?
No.
Okay. I'm going to have a seat and just go through some questions with you.
Okay.
Can you tell me a little bit about your medical history?
Just had my tonsils out when I was 7. That's it.
Okay. Any other illnesses or?
Nope.
Okay. Any other surgeries in the past?
Nope, just the tonsils.
Okay. Any significant family history of heart disease, stroke, diabetes, anything that you can think of?
Nope.
Is your parents are both healthy and living?
Yep.
Okay. Are your immunizations up to date?
Yes.
Okay. Are you allergic to anything?
Nope.
Do you smoke?
Nope.
And do you drink alcohol?
Nope.
And can you tell me about what you do for a living?
I'm a nurse.
Okay. And can you tell me a little bit about your hobbies? Anything you like to do in the for fun?
Nope, just read occasionally.
Okay. I'm going to start an assessment.
Mhm.
So I'm going to do a head-to-toe assessment on you. So first I'm just looking at Trina's general appearance. I'm looking at her skin, her hair, and her nails. Her skin looks nice and pink and warm. She's dry. She's not diaphoretic. Her nails appear to be well-rounded. They're not brittle. There's no clubbing. And her hair seems to be non-brittle, evenly distributed. So Trina, the next thing I'm going to do is assess your eyes. So I'm looking at your external eye, looking at your periorbital area, your eyelids. I'm inspecting for any redness, any swelling, any deformities, any trauma, which there seems to be none. I'm looking at both sides. And Trina, I'm going to have you look up.
Mm-hmm.
And I'm just going to inspect your conjunctiva here, which appears to be nice and pink. There is no redness or drainage. I'm also going to I'm looking at Trina's eyebrows as well for any deformity, any trauma, which there appears to be none. So Trina, the next thing I'm going to do is test your eyes for convergence and accommodation. So if I can have you take a look at my finger.
Mm-hmm.
I'm going to bring my finger towards you, follow my finger with your eyes. You are going to go cross-eyed, but that's what is supposed to happen. And Trina's pupils are both accommodating and converging when I bring my finger towards her nose. The next thing I'm going to do is test your visual fields, your peripheral vision. So I'm going to bring my fingers towards you on the sides here and let me know when you see my fingers.
Okay. Yep. Yep. Yep.
And the next thing I would do is perform a fundoscopic exam in which I would use a ophthalmoscope to visualize her red reflex in her eye, her optic disc, and the blood vessels in her eye. So the next thing I'm going to do is inspect your ears. So I'm just going to inspect this side for the purpose of this video, but in real life I would inspect both sides. So I'm going to start by just inspecting the outside of the ear for any signs of trauma, looking inside of her canal. Her ear appears to be nice and pink and warm. I'm going to feel your ear. Let me know if there's any pain.
Nope.
So this is her pinna, her tragus, and then her lobe. And the next thing I would do is look inside of her ear with an otoscope to visualize her tympanic membrane, which should appear to be pearly, grayish white. And again, I would do that on both sides. So the next thing I'm going to do, Trina, is assess your nose. I'm just looking, right now I'm just starting with inspection, looking at the outside. There appears to be no trauma. There appears to be no drainage coming from her nares. I am looking at her nares for any flaring, which she does not have. And from here, I'm going to palpate your sinuses. So I'm going to palpate your maxillary sinuses. Are you having any pain?
Mm-mm.
Here?
Mm-mm.
Here?
No.
Okay. And then your frontal sinuses. Any pain here?
Nope.
So her sinuses are non-tender. And then I would go and look inside of her nose with my otoscope and would look inside of her nares to look at her turbinates, assessing for patency, for any septal deviation. Her turbinate should be nice and red and moist. And the next thing I'm going to do is assess your mouth. So I'm assessing Trina's lips and her buccal mucosa. So can I say ah,
Ah.
and her soft and hard palate are intact. There is no redness, no abnormalities there. And with a glove on, I would palpate around her gums, around her buccal mucosa to feel for any lumps, bumps, any pain or tenderness, or any abnormalities. Can I say ah again?
Ah.
I'm looking at Trina's tonsils, which appear to be 1+ in size. She does not have any tonsillar swelling. And I'm going to move on to your neck. So if I can have, just sit forward for me. So I'm going to palpate your some of your lymph nodes. So I'm going to start with your tonsillar. Any pain there?
Nope.
And then your anterior cervical. Any pain there?
Nope.
And then your posterior cervical. Any pain there? Okay. And the next thing I'm going to do, Trina, is palpate your thyroid. I'm going to feel for the isthmus and the lobes of your thyroid. So if I can have you, and I'm going to do this from an anterior approach. So I can have you swallow. Good. And I feel her isthmus here, and then the lobes of her thyroid on the side as she swallows. So the next thing I'm going to do is assess your respiratory system. So Trina does not appear to be in any kind of respiratory distress. She is not having trouble breathing. Her breathing is even, non-labored. Again, as I said, she appears to be nice and pink and warm. She does not have any cyanosis or discoloration of her skin, which could indicate a respiratory disorder. And I'm inspecting her thorax for any trouble breathing or any signs of distress. So what I'm going to do is use my stethoscope and listen to your lung fields. So if I can have you take a big deep breath. Maybe turn around and listen to your pant side here. Take a deep breath. And one more. Good. All right. All right. Thank you, Trina.